The topic for our presentation today is application of classical conditioning on psychological disorders or therapy, also known as behavior therapy, presented by the Psychos. Ding! 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 Ding 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 ding! Behavior therapy involves changing behavior to reduce dysfunction. It is based on studies of classical conditioning by Pavlov and operant conditioning by Skinner. Systematic desensitization is the principle of counter-conditioning to help overcome phobias. Relaxation is used to help anxiety. Techniques include hypnosis, mental imagery, meditation, Jacobson progressive muscle relaxation. Hierarchy construction is when constructing a hierarchy, clinicians determine all conditions that elicit anxiety. Then, the patient creates a hierarchy list consisting of 19 to 12 scenes in order of increasing anxiety. For example, discussing riding an elevator with the therapist and looking at a picture of an elevator. Desensitization of the stimulus in the final step. Patients proceed systematically from least to most anxiety-provoking scene while in deeply relaxed state. Phobia object situations are conditioned stimulus paired with fearful stimulations. When paired with new relating stimulus, the phobias are treated. Aversion therapy is another way to reduce the frequency of the undesirable behavior, such as smoking or overeating, by teaching the client to pair an unpleasant stimulus that results in undesirable response. These are the types of aversion therapy: overt sensitization and covert sensitization. Flooding is another way of effective form of treatment which is invented by Thomas Stumpf. It works on the behavior principles of classical conditioning. It's behavior therapy technique in which the person is rapidly and intensely exposed to the fear-provoking situation or object and prevented from making the usual avoidance or escape response. The medication of flooding are phobias, post-traumatic stress disorders, and obsessive compulsive disorder. The advantages of classical conditioning techniques are short duration of therapy, easy to train the clients, cost-effective, and duration of treatments is usually 6 to 8 weeks. In conclusion, behavior therapy is based on the theories of operant conditioning by Skinner and classical conditioning by Pavlov. Behavior therapy techniques has contributed to education and treatment of psychiatric and medical disorders. And with that, thank you and goodbye.